and the Wendat people. And it's now home to many diverse First Nations, Inuit, and Métis people. We acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the New Credit. And I, for one, am grateful for being here. Per our usual practice, this morning's meeting is being live streamed on Toronto Community Housing Board live YouTube channel. Following recommendations from our tenants, we are also recording the meeting so that those who are unable to attend can review at a later date, and that was an excellent suggestion, and I'm glad that it's in place. During our meeting today, we're going to follow some best practices. I'll be reminding all speakers, board members, staff, and deputants alike to use the microphone. Using the microphone is the single most important thing we can do to ensure that everyone following the meeting can hear what is said. And any of you who have joined online know how frustrating it can be when you can't hear it. I'll also remind people to speak clearly so that your words are understood. And if you can actually identify your name before you speak, that would be great as well, so that people actually online know who you are. And with that, we will get started. We had a very brief in-camera meeting to consider some HR issues, and the Ombudsman report. We're actually looking at seeing if some of the Ombudsman's reporting can come to the public session, and we will come to bring that back to a future public meeting. Ahead of us is an agenda, and I want to just ask the members of the Tenant Services to take a look at the consent agenda, which includes the approval of the public meeting agenda, any conflict of interest, confirmation of the public meeting minutes of October 7th, and the business arising from the public meeting minutes and action items. I'd like to actually just ask if there's any conflict of interest first. Any conflict of interest with the agenda? Hearing none. Is there any items under the consent agenda that people would like held?
Well, I think it's important to go through the action list.
Yeah.
We never have it on the consent agenda, actually.
Sounds like a good plan.
I would like to ask that for the future.
Okay, we will make that change.
Do the approval of the agenda.
So let's do an approval of the agenda and the minutes of October 17th or October 7th, and we'll hold on the business arising, and we'll make that a regular standing item. Can I have an approval? Thank you. Seconder. Uba, can I put you down? And all in favor? Great, thank you. And let's look at the business arising from the public meeting, and if everyone wants to take a quick look at that to make sure that we actually have captured items that are important for us to make sure are on our radar and that we're actioning on. Any comments on the business arising action list? Yes, Paula.
Just on number 5, the vacant unit.
Yep.
That is in progress.
Yep.
We're dealing with that today.
Yes, we are.
And we're going to hear about market as well as our.
Yep. There's a thorough report there.
Oh, I'm sorry.
I'm sorry. I've broken the rules already.
I did.
Yeah.
I didn't have that microphone on. Now, and I hate having my back to everyone, and I really do apologize. I think we should meet in a better room so people don't have to look at our backs. I'm just clear on are we on track for Q1 2020 for the process through which market units are rented out, and how many have been rented since 2018 and 2019?
Our agenda, isn't it?
Is that all on track?
Yes, we are.
Okay.
Thank you. Any other questions? All right, I think some of the, quite a few of the items we do actually have in the agenda. So with that, we'll move on to.
I'll move
we
that.
need a motion. Paula, seconder. John, all in favor?
Yeah.
Thank you. And thank you also for your comment, Paula, as an aside on the meeting and the format. We actually are taking a look at that with maybe some hope to make some changes in the new year.
Well, I think the governance committee is going to look at all manner of these and make a recommendation.
Yeah, I think but to that end, if you have any suggestions in terms of this committee in particular, let's make sure that we actually put that forward, because I think that tenant services in particular, finding a way to actually meet with tenants, perhaps at times and places where we can actually meet more tenants, is something that I'd like to see. So we'll put that forward for some discussion in the new year, but you prompted my thinking, and I was going to mention that in the chair's remarks.
I think maybe you should come to the governance committee.
Yeah,
when that
absolutely. But if
conversation-
people have thoughts
Yeah.
about that in advance, I think we should feed into governance, because I think you as tenant services committee members might have some particular input about just this committee.
Yes.
Yeah, okay, thank you. We'll move on to the next item, which is the OACH work plan. We did actually have a look at the commissioner's work plan in the public session, only because that's an HR in the confidential session, but we will now look at the work plan for the office. We have been looking at, we've had some inputs onto this over the last couple of meetings. Hopefully people have had a chance to take a look at it. Do you want to open up anything, Cynthia, with this?
Thank you. I'll be very brief. Essentially, you'll see that the goals of the office are divided in 3 areas. The first one is supporting tenants, vulnerable and senior tenancies, with deliverables related to numbers of tenants that we'll work with and avoid eviction, but also with some more specific details, such as ensuring that small amounts of arrears are paid off in a shorter period of time, thus allowing tenants to remain in their housing and not to accumulate further debt. Then if you look at the section, the second goal, it's all about accountability. We talked a little bit about this in camera. Something that you'll see that's quite different this year, and I think a really positive movement, is some of the accountability here is both for the Office of OACH, but also for TCH, because we're going to be working closely together on our shared goal of eviction prevention and arrears reduction. So for example, if you look on page 4, over at OACH targets, TCH demonstrates compliance with 90% of the commissioner's recommendations. So we'll talk about that a little bit more later, but I see that as a very positive point. And then the third section deals again with the new seniors, new model, working closely to ensure that seniors are protected and avoid eviction wherever possible. And something that's quite new is OACH is going to be getting involved a bit earlier with seniors with the goal of avoiding eviction. And last but not least, under that area, you'll see on the final page that OACH will be providing training to seniors to deal with issues related to turning 65 and some of the challenges there, and to dealing with eviction prevention and arrears avoidance. So with that, I'll leave it to any questions that there might be.
The deputation. We've had a late entry for a deputation on this from Catherine Wilkinson.
Thank you, Madam Chair. My apologies. I wasn't aware that we need to come into the meeting to actually depute. Typically, we register depute in the lobby. When we walk in here, there's usually a desk set up, so I'm waiting to see who do I tell I'd like to depute, and you're already at the table.
Go ahead.
So my apologies. Now that I know that, I'll run right in here and get your attention. Okay, so, I've been following OACH closely, and the work plans and such. And I think there's some really good goals, actions, and targets and outcomes to be as a result of this 2020 work plan. There's a couple of items that popped out at me. One is on page 2, the last point there under F, under the OACH targets, 80% of the tenants referred to OACH have adhered to OACH brokered repayment plans as measured after 1 year. I think this is a bit of a stretch goal. The OACH, like the TCHC, has absolutely no control over whether or not a senior may breach their repayment agreement. And it's great to aim for that, but quite frankly, we can't control how a tenant manages their finances and whether or not they breach, and all we can do is determine if there's extenuating circumstances that warrants another look at it. So I'm just wondering if this is going to be a new metric also expected at Toronto Community Housing, right? That they're gonna have a percentage for their TSCs that are expected also, that the tenants don't breach. So that's really something to think about. We're not in control of tenants' personal finances. And on page 4, the very item 2 under OACH targets, TCH demonstrates compliance with 90% of the commissioner's recommendations. Well, we already know that for the past 5 years, very few, if any, of those recommendations were implemented on the Toronto Community Housing side after they were recommended. I'm not sure that OACH can take responsibility for Toronto Community Housing staff. That's when your auditor makes the recommendations, it's then up to management to ensure that they're implemented or make suggestions why they shouldn't be. And the other thing I'm happy about is under the OACH performance outcomes, regular meetings have been established with the 3 operations divisions. This is really good news. I know it's something that OACH has been aiming for. I know we really need to sit down. We're not going to get at the arrears for seniors of this organization until we sit down and start talking to each other and figure out how we can collectively, how can we do this better to help people keep their housing. And the other, I had one other item on this. And then on page 6, under number 3, under OACH actions, working closely with the general manager seniors housing unit. We need to have a plan to get the seniors out of arrears. We're already going to be, some of those housing units will be going over to the city. You know, whether we need a SWAT team that's going to manage the arrears and get these seniors out of arrears so we can focus on that, so they can start off with a good tenancy when they go over. And the other thing I want to point out is, you know, Toronto Community Housing is putting additional resources as a part of the new organizational structure. That includes hiring additional staff to review tenant files, including arrears. Now, while Toronto Community Housing is once again staffing up to get at the backlog, to get at these arrears, there's not even a suggestion that we do the same over on the OACH side. Now, clearly, if your staff are processing files quickly, the arrears will also flow quicker to the Office of the Commissioner of Housing Equity. And we need to make sure that they have the right staffing complement when that tsunami hits. So as part of the budget, I do think we need to consider whether there's additional staff going to be needed at OACH once you have additional staff at Toronto Community Housing. Thank you.
Catherine, is that your number 4 comment? Because you were you have a deputation for number 4. Was that your arrears comments?
No, that's another report, but if I'm the only one, I'll bring it too.
Is it okay if just because it links to this, to the OACH, if we actually hear from Catherine, she's the only deputation for number 4 as well, and then we can consider both? Because you started talking about arrears, so.
Right, and the two items do flow into each other, thank you. Yeah, so what I've just actually said is what I've said about this report too, that we need an arrears SWAT team. We truly do. We're at that point where we can't just poke along like we have been. We need to get in there. We need to target on the arrears. Perhaps it's the internal audit team. They're very good at looking at these things. And again, targeting seniors and vulnerable tenants. And I will say, on page 2 of 4, to the Chief Operating Officer's credit, I appreciate that management gave an honest response to the recommendations made by the Commissioner of Housing Equity. And I really like the plan that's been put in place about the working group, as I mentioned earlier. And clarify and on page, what is that, 2? Page 3, the working group, where they talk about clarifying the timing and the process for transitioning files from Toronto Community Housing to the Office of the Commissioner of Housing Equity. We need to consider that would actually be changing the language to the existing terms of reference. That terms of reference was approved by the city. So we as management cannot just arbitrarily change the functions or the role without some sort of consultation. And the internal audit review of arrears files at the bottom, it talks about this report going back to BIFAC. The Tenant Services Committee has carriage of tenancy issues, including arrears. And so I do think that that report should also come back to this committee, not just to BIFAC. And I also think it needs to go to the board, which I think ultimately it will. And that's my comments on the arrears.
Okay,
Thank you.
Thank you. I'll let John.
So in regard to the first part of your deputation, you made reference to it not being OCHA's responsibility to fulfill the recommendations of the ombudsman, but being management's responsibility. And you said in a number of cases, management has not completed those assignments or fulfilled those obligations.
Right, as indicated in the report, the top three issues identified have consistently gone up over a period of 5 years, which is an indicator we haven't really been implementing those recommendations on the TCH management side.
Is there a specific recommendation or
Yeah, there's
one that's
three
most-
recommendations outlined, and then there's a bar chart that shows you how those three recommendations have not been implemented over 5 years. But the fact that management is acknowledging this, and they have a plan to work around it is what I'm saying, that we really, and I'm pleased that we're gonna work on that, because if you're not, you know, the Commissioner of Housing Equity is an independent accountability office, and she's auditing these reports, coming back to Toronto Community Housing with recommendations. Now, ultimately, it's up to management to ensure those recommendations are implemented. If in fact they had been, OCH may not be here today. But because the arrears have skyrocketed, we need OCH now more than we did 5 years ago.
Got it, thank you.
Great, and I hear, thank you, Catherine. I'm hearing this is somebody who has watched the OCH process for a long time, and I actually do think that the optimism that I hear in terms of we have a chance to make some changes, and we're gonna hold people accountable to making those changes, including stopping the construction, hopefully right above us. Is there any?
This is part of the
can I?
capital works that we've planned here.
So we've
Really
bridged
start.
into the two areas of the OCH work plan and the arrears collection process. Can I ask if there's any other comments from the board members on either of those items? Can I have an approval then of both number 3, the work plan, and number 4, the collection process? Because we've talked, thank you, Uba, second. Amanda, all in favor? Great. All right, so we are going to number 5, which is the seniors quality update, a quarterly update, and I believe that we have some deputations on that.
Yes, I think the first deputation is Bill Lohman.
And he came in right on time. Thanks, Bill.
Hi, Bill.
We'll get you a microphone. I think we have some handhelds.
Can I just ask in this report before we get started?
Yep.
There's these region map of levels of
Yep.
need, but then there's only one region that we have a map for.
I thought we had
Is that-
more.
I don't,
I
I
did
only
online.
have the southeast region. Am I missing something?
Yeah,
I
there's.
know online I had them, more than one. We're just checking.
Let Bill start his thing and we'll
Yeah, we'll
make
make
sure.
sure.
that we-
Sure, the public actually has
Yeah,
all
let's-
of the information.
Let's make sure. I think it was online because I thought I saw it on my.
Go ahead, Bill.
Okay, Bill is going to start us off.
Great.
Good morning.
This morning.
Good morning, Madam Chair, Ms. Penny, Mr. Marshman, committee members. My name is Bill Lohman, and thank you for the opportunity to submit my views this morning. I have to say that I'm pleased to see the forward progress on the ISM, even though it appears to be back-facing. It's a good thing knowing that the professionals in multiple health and social disciplines are involved to ensure their linkage in the model. It really is an accomplishment to sync the varied interests that are involved. And I have some idea of knowing, because I've participated on a few of these social medical advisory committees over the past 10 years. And I've witnessed the professional and the agency claim staking. Plus, Saranac Community is part of the Baycrest Hospital's pilot for the Central LHIN's medical-based model. As I'm nearing a time in my own life when I will benefit from these services being parceled into the integrated service model, I know that I will be most thankful for them being available. This platform will be a bedrock for the future delivery of health and wellness services to accommodate Toronto Housing's growing senior population. Are you satisfied with your efforts? Has anything important been left out of your calculus? For all the time and consideration that's been put into the development of this service model, one thing has been glaringly absent. The isn't listening to or even directed to tenants. It's designed for patients in need. It's the professional medical approach. We know what's best for you. It sounds great for palliative seniors and mall walkers, but what about front-facing needs that exist for seniors every day? The isn't addressing some of the most crucial aspects needed to promote and maintain a positive quality of life in seniors' communities. There are numerous documented studies that prove creative programming and recreational activities are just two of the important components necessary for seniors to maintain a positive outlook during their waning years. Off in the distance, I can feel the lonely rattling advance of the physical realities in my own battle for balance. Can we add a touch of front-facing human empathy to your discourse with tenants? It will make the pill of change much easier to digest. Look, we've all been guilty of reaching misguided conclusions from incorrect assumptions. Ambiguities over this past summer are now showing me how some of my own prejudgments, absent all the facts, have resulted in inaccurate assumptions on my part. Maya Angelou said, "Make every effort to change things you do not like. If you cannot make a change, change the way you've been thinking. You might find a new solution." Well, what we came up with is the Saranac Inspiration Engagement Pilot as one potential approach to generate a positive communication interface between tenants and staff. Its purpose is to explore a tenant-focused opportunity for creativity and growth through a community empowerment. Our glass painting artists are exhibiting at the Nielsen Park Creative Center this evening, and there is attending a reception. Our pilot is an attempt to animate the vision that tenants voted for during the 2016 PB consultations, when Seniors Voice proposed an alternative model that would ensure equality for all communities and give tenants more direct financial control of their community's engagement efforts. This pilot is not attempting to create a one-size-fits-all approach for housing engagement. However, we are working ahead of the curve to implement our standards and procedures and can trailblaze for the integrated decentralized model. Our hope is that our efforts will offer other communities an engagement framework that can be drawn from to personalize the development of their own accountability protocols. Saranac is excited to learn the engagement pilot that this community has been fostering over the past year is receiving a serious look by Toronto Housing as a positive communication approach that aligns with both the city and housing's decentralized expectations. I'm particularly grateful for your willingness to support our efforts with a renewed pilot agreement that includes a nonprofit community animator that adds support to our recreation and engagement efforts. So, appreciation is the magic formula that you've all been waiting for. So, happy holidays to all of you.
Next item. Anita?
Thank you. Sorry about that.
I think we,
Yeah, I know. It's unbelievable. No, it's unbelievable
we've got it. Yeah, we have it. Thank you.
that this is now absolutely not. We're rejecting this one, keeping the one that's the public one. This is
Lest we forget. Less than a month ago, these words were repeated often. Today, I'm asking you not to forget the staff and the tenants who have made a huge difference in the lives of others. As a committee or a board, you have an awesome responsibility in your hands. You have a responsibility to make decisions that impact on our lives. We worry that we will not have a roof over our heads or enough money for food and medicines. There are many changes which has and is still having a great impact on staff and tenants alike. Staff are concerned they will have their jobs. Some have been issued letters that their jobs will be terminated very soon. Some are hanging in and still being responsible. Others are lackadaisical and make it quite clear to us, the tenants, that they do not care. Your tenants are suffering during this chaotic time. Tenants are terrified that they will lose their housing, or RGI. Vulnerable tenants are becoming more vulnerable than ever. There is nowhere to turn. A short while ago, living at TCHC was becoming tolerable. There was a little bit of hope. Now, hope has failed. Some tenants who were your unpaid workforce, tenants who made a difference and volunteered, are no longer interested. These tenants have been verbally abused, discredited, and harassed. You have actually accomplished exactly what a bunch of sick, evil people do. They bully and put others down. Tenants are told to cooperate or they will be evicted. Imagine living under those conditions of always fearing that you're going to be evicted. Your tenants are living here by a twist of fate, or as some call it, destiny. Some unfortunate thing has happened in their lives, some of it by their own making, but some of it is just bad luck. Some tenants have been physically, emotionally, sexually, or mentally abused. Some have fled countries of civil war. A lot suffer in silence. Some have post-traumatic stress. Whether it is a senior who lived through the horrors of the Second War with rations and concentration camps, or went and fought in Vietnam, Afghanistan, the Middle East, the Korean crisis, and many other wars in uncivil times. A person who has had their own battles and has to endure the prejudices of religion, sexuality, race, disabilities, health issues, or bad family beginnings. Lest we forget. Please, at this time of year, let's be a little bit kinder, less to judge. Show compassion in your decisions. Please make wise decisions. Please let your tenants know that they are valued. Learn to praise good staff and good tenants. We all need a little bit of recognition for our achievements. Lest we forget. Please remember how you impact on the lives of your tenants. Thank you for your time.
Thank you, and I know we're doing some recruitment right now, and I would just ask that our staff actually take the words that have been given to us in terms of going forward. And I don't want to ask specifics, but I think that if there are specific situations of bullying that you have mentioned, that you actually make sure that it gets to Sheila and her team. I don't want to actually.
I would need a whole meeting to.
Yeah, well, I think where there are specifics, we need to actually make sure that there's a culture where we're held to account. Would that be fair to say? Okay, thank you. And we have another.
No,
That's it? Okay, so thank you. So I just want to clarify, did the report actually get to people that were, for this one we were, okay, so everybody has it?
And I've got a brief presentation that's up on the screen, so if we can.
And was it circulated to the public as well?
It's on, it was, the posted, yeah.
I just wanted, there was some
Material,
questions before.
yeah.
Sorry, I'm sorry. We have something in our binder. That is the report. Now we have something else that we're going to see this morning.
I'm just going to take, this is just to facilitate the discussion. So it's not material that's new to what's in the report. It's just, I've got a PowerPoint that I'm going to take you through that repeats the information that's in
I
the
find
book.
it different than the information we have in the report, so I'm a little concerned about that. There's more information in the report than there is here. And John has 5 reports. How many have you got? 4.
Sorry,
So this is a PowerPoint, it's not the report. I want to be clear, Madam Chair.
Yeah.
the report was accompanied by a PowerPoint. That PowerPoint is still available if members of the committee have questions about that report. That PowerPoint they can. As I understand it, this is a focused version of that same presentation.
Let's hear the presentation.
Yes.
Got it.
So, can you put it up full screen?
So this is just a PowerPoint, not a decision point.
Like in slideshow presentation. Thank you. Good, thanks. Just go to the next slide. So what seniors told us is that they want is clean and well-maintained buildings with repairs that are completed on a timely basis. They want to feel safe in their homes. They want increased access to health services and social supports in their building and the broader community. They want more frequent and proactive and respectful communication with staff. Those are the four key findings that came out of the interactions that the city, TCHC, had with seniors groups. Integrated service model. The ultimate goal of the integrated services model is to ensure that senior tenants have successful tenancies and importantly can age in place in comfort and in dignity. Certainly the city has talked about the growth expected in the seniors population over the next 20 years and that this is a key element of how the city expects to respond to that model. Our model proposes new ways of operating and interacting with tenants to meet the needs of those objectives. And it includes key innovations in terms of our relationships with the LHIN, new staffing models, and new operating procedures. One of the things that we had noticed in the seniors building is the need for additional staff at the building level. One of the key roles that is being implemented in this model is the Housing Stability Coordinator. It's the main point of contact for all tenant-facing services in a building. It will take on the CSC function with responsibility for tenancy management as well. And it will liaise with building staff and knows where to refer clients to the client care coordinator or the lead agency staff in it. This is a critical part of the work that has been developed in conjunction with the city and the LHIN as this model has been developed. The Tenant Services Administrator takes on the administrative aspects of the tenancy function. So it's the routine correspondence, it's the performing the rent assessments, it's the collecting of arrears. Those roles today, right now, are in one individual, and this model clearly recognizes a differentiation in the tenant-facing role and the administration back office role. The support and engagement supervisor works out of the area office and manages supports in the buildings itself. So when we look at the new operating procedures and policies, you know, it really is a look at how do we wrap around a set of services to ensure that we have an innovative approach to providing the appropriate supports in conjunction with the LHIN to ensure that tenants can age in place and avoid any eviction prevention sort. We're looking at how to make the communications more user-friendly, and I should actually acknowledge that Jay Preet and Andrea Austin, Andrea's in the city, both of them have been are in the group. I should have said that earlier. They're there, stand up, wave, you know, and certainly can, you know, can augment anything, because obviously they've been both very much involved in the development of this work. Each of the 5 sectors will have a dedicated LHIN care coordinators in the building, and there's clear partnership agreements with community service providers. Next slide. This is the region map of the 5 areas, the 5 geographic regions within it. Each region's roughly 20% of the portfolio. So on average, there's just, you know, just shy of 2,800 units in each of the readings. Next page. Next page. Oh, sorry, sorry, page back. Sorry, I missed that. Sorry. So the phased one approach, and this is the approach that we are launching in the second quarter of next year, is in the Southeast region. And why was the Southeast region chosen? You know, the first element is the data shows that this region's average level of need resides in the middle of all three. So it's not a low needs area, it's not a high needs area, it is the average. So it will give us a good baseline. And starting here will allow us to learn lessons of how to scale up and how to scale down for the regions with higher or lower needs. And that was primarily one of the reasons that it was picked. So if we look at next steps, there's further consultation with seniors tenants that are planned, the council budget approval and staffing for phase one. This isn't, you know, the staffing and this model is included in the TCHC budget that will be presented to the board at the full board meeting at its next meeting later this month. Recruitment and onboarding following the budget approval will take place, and the expectation is that we will have this the phase one fully staffed and implemented in Q2 of 2020, probably near the later part of Q2 as opposed to the earlier part of Q2, but we will move as quickly as possible so that we can start the data collection in order to do the assessment. And with that, I will stop and between Jaypreet, Andrea, and myself, answer whatever questions the board may have.
Great, thank you. John?
So aging in place is a concept that retirement homes typically try to do, and some homes you can age in place until you require nursing care or long-term care. In some cases, you age in place until you can no longer, or they can no longer provide you with the proper service or the service that's necessary. What happens to, is Toronto Community Housing being set up to become a long-term care provider for some residents?
No, it is not.
Okay, so there is a point at which an individual who can no longer care for themselves will be, through whatever process I don't know what's happening with the LHINs, but they will be then transitioned to a long-term care facility. Is that's
In the same fashion that all other citizens would be.
Yeah,
yes.
they will not be treated differently than anyone else that has
Because it just,
the desire
aging
to
in
live in
place,
their own home
aging in
as long
place
as possible.
is until a certain point in time. Then that's really.
Yes, we specifically are not becoming a long-term care facility.
So that's okay. I just wanted to know that. And then, why are we taking a phased-in approach with one region? Why are we not? This was the city. This is a council initiative, and to set up the seniors portfolio and focus on the seniors buildings, the 83 seniors buildings. And I'm just wondering, do we not have the manpower to do it all in 2020? Just wondering why the phased-in approach is being taken. And if it is a manpower issue, I understand that. And then when can we expect the rest of the portfolio to come into the envelope of services?
So I'll take the first part of that question, and if I miss anything, Andrea can certainly, update that further, given that she represents the city in this discussion. The motion that went to council contemplated a phased-in approach, and in fact identified that we would do a phased-in approach starting in this year. And I think to some degree it was driven by the LHIN, and the LHIN wanting to develop baseline data in terms of gaining information relative to its objectives and the achievement of those objectives through this model. I think the other thing too, that just a phasing approach gives you on something that is significantly different in practice and approach than it is in the past. It gives you a smaller model on which to work at, to make refinements in, John, and then when you do go to the full rollout, you can incorporate those activities in the forward. So it's a bit of a learning lesson. I would say that there is as I understand it, a year's worth of data that the LIN wants to collect, and they will be collecting it on a monthly basis, so won't be waiting for the full year, and then be moving forward. And that's that's the province's responsibility to us in terms of, and their requirement of us in this.
So what data are we talking about? What kind of information are they looking for that they don't already have?
Andrea, I have that, I just don't have that readily available.
Do you want to introduce yourself as well? Thank you.
Sure. So my name is Andrea Austin. I work at Senior Services and Long-Term Care at the City of Toronto, and I've been working very, very closely with the seniors housing unit here to try to create the integrated service model. So part of the reason, I just want to go back to the first part of your question. Part of the reason that we're rolling it out as we are is because we have a scientist and an evaluation expert, actually two, embedded in this program. So we applied for a CMHC grant for $250,000, which we got, and that is essentially paying for these two PhDs who are evaluation experts to help us make sure that the program is evaluable. Evaluation is complex. And so we need to understand what data is available from Toronto Community Housing, from the Toronto Central LIN, and from the city in terms of police, fire, calls for paramedics, and all of that information together, and making sure that we have a baseline data so that we can ensure over time that we can deliver on the outcomes that we want with respect to this program. So we want to learn from the first rollout and to incorporate that as we go to all 83 buildings.
Thank you. Can you give me an example of the kind of data that they're going to be collecting?
Sure. So so this is part of why we, when we looked at all of the 83 buildings, we looked at low, medium, and high needs buildings, and that's things like calls to CSU, 911 calls, visits to the unnecessary visits to the emergency department, like all of that kind of data. But so it's really a collection of all three sources of data. Any one of us can look at the city can look at its data, you can look at the Toronto Community Housing data, the LINs can look at their data, but when you put them all together, you see a very different picture than looking at those individual data sets.
Okay, so basically what they're going to be doing is making an assessment about whether or not the integrated service model is resulting in a reduction of emergency situations.
It's not just that. We'll also
Emergency situations and perceived emergency situations, and that
Kind of wraparound supports.
and that people are
Yeah.
in a better state of physical and mental health.
So absolutely, we want to reduce unnecessary visits to the emergency department, unnecessary hospitalizations, and premature admission to long-term care, and certainly to reinforce the aging in place approach. But it's also things like tracking how many referrals are made to community support service agencies and health support services. So we want to make sure that those are going up. So we have a number of indicators. I think right now, JP, I think we have 20 key indicators that we're looking at that we want to say, okay, this number we want to go up, this number we want to go down. And that's what we're working with these PhDs from the Sunnybrook Research Center to make sure that we can, in a year from now, we can actually take a hard look at that data, that combined data, and tell the story of whether or not the integrated service model is working and whether or not the integrated service model is responsible for that success.
So just one more, sorry, because I know my colleagues are going to have questions too.
A few other people have questions.
So again, I'm just going to come back to, why the phased-in approach? I mean, we are specifically, and listen, I fully support this. But why the phased-in approach? And we're going to the middle range of need. If our goal is to improve the lives and the lot of residents that are seniors, why not broaden the scope and go to the middle range of need, and then the buildings where there's the highest need, so that we can more quickly provide services to those that are in most immediate need?
So the reason for that is because we wanted to look at low need buildings, medium need buildings, and high need buildings, and be able to roll out the integrated service model in such a way that in year 2, we can scale up or down as is necessary. So it may be that, you know, a high need building needs a very different approach than a low need building. So that's why we did it in such a way as to roll it out that the buildings that are identified in the southeast, these 18 buildings in the first round, are an amalgam. They have high, medium, and low need buildings. So will give us an opportunity to figure out which of the development, which of the initiatives are actually things that we need to scale up in the high need or scale down in the low need.
Okay, good, thank you.
You're welcome.
Thank you. Debbie?
Andrea, from what you've been saying, I hope you can appreciate from John's question why what I'm receiving from the information is that we're privileging evaluation over intervention. And I understand the purposes for it, but that's the optics of it. So I'm expecting you will get a bit more pushback. Are you then saying that while you're looking at the medium need buildings, that nothing will be done at the high needs end? Are there not obvious interventions or?
No. So first of all, let me say that we're taking a results-based accountability approach here to say how much are we doing, how well are we doing it, and who is actually benefiting from this, and to actually demonstrate the effectiveness of this approach. If we can demonstrate the effectiveness of this approach, you know, that will stand us in better stead going forward in terms of getting support for this. We actually, as part of this CMHC grant, did we hired Canadian Urban Institute to look into, to do like a jurisdictional scan of what was out there. There actually is nothing out there just like the integrated service model. So we think this is very extremely innovative work, and bringing dedicated staff to the building and additional staff to the building, and ensuring that we train all staff to be much more, human and kinder, and just be, look at people's eyes and say, good morning, and how are you, and that sort of thing, and just be warmer. That also is going to go the distance. But we want to absolutely demonstrate that this works. I guess Kevin could answer whether or not we would be able to, within 1 year, hire that many people and roll it out in 1 year. I'm not. That's a TCHC question. I'm sorry. What was the second part? That was the first part.
No, that's fine. I have another question because I don't want to take up a lot of time. Are you looking at collecting demographic data as well as you move forward? So you talked about looking at number of referrals to community-based service organizations. You also are going to be looking at whether or not you're seeing a reduction in what you're calling unnecessary visits to emergency, for example. Then will you then be tracking demographics in terms of race and disability and language and those kinds of things in terms of what interventions are working for which people, or if there are different interventions that are required given someone's identity?
I think I'm going to call Jay Preet up on that, just because under the Housing Services Act, I think there are certain restrictions on what can be collected. I'm not sure, I'm not the expert on that. And I'm also not exactly sure of what demographic data and how deep the demographic data goes in terms of what Toronto Community Housing has right now.
Actually, that's a good point. Last year I raised it in terms of beginning to track demographic data, and I was told that work had started. So I'm hoping that it's true that the work has started and we have something to work with in terms of who lives in our buildings.
Good morning. So in terms of our operational work on the ground, we have access to that data. We are currently organizing some of that. So one piece of data that we've currently organized is language by tenants by building. So based on the data that we have, we're going to be able to hopefully target and tailor specific services to the needs of the diversity of our tenants.
Good. So good that you're collecting language. Hopefully, you're also collecting issues of race and disability.
Yes, so I mean, this is a starting point. We
Yeah.
have the data. It's a matter of organizing it and then developing programs to then address the present needs.
Thank you.
Thank you. Paula?
Yes, I just want to just be clear that this is part of the Tenant's First initiative, and I don't see that
Yes.
anywhere in the report, and I would always want to see that in the report.
Yeah.
That this is our Tenants First. Also, I understand the overall lead on this whole thing is the deputy city manager. Can that be confirmed?
Yes, that's correct.
So I think that should also be included in a report to the board. The board doesn't,
Yeah.
I don't think people know that.
Yeah.
So what our structure is going forward and how we're operating,
And what
I
we're
believe
responsible
is
for.
important because we're moving a unit. Nonetheless, and there is going to be, I believe, Kevin, a new person coming in on the seniors unit.
Yes, and we expect to be able to announce that momentarily.
But this board still has oversight
Yeah.
for that. So I'm going to suggest that we, governance-wise, start to have that more separated out than just an agenda item at, if it's at
Seniors,
this
yep.
committee,
Yep.
if the seniors unit is going to report through this committee, I understand we are, that's where this information comes, right? It's not at all the other committees.
Yes, we report on a quarterly basis to this committee on the seniors program.
That be a
First.
standalone,
Yep.
separate item, not just a board item, in order to start to understand the differences. And I would like to have the deputy city manager attend to a board meeting when we have that on our next agenda. So those are some requests to you, Madam Chair.
Sure.
And also to the staff writing the report. The thing that I think this is, I'm back on the report, that we have 83 buildings in 5 regions, and we've got regional boundaries. And then we've got 26%, 49%, 26%. I think maybe this is the only foundation document that we've had where that information has been here. But having that as so there's 83 buildings, 21 of them are low needs, 41 of them are in the middle, another 21 are high needs, so that we actually put numbers beside the percentages. Then we get to our chart, region map and levels of need. I think it's important to understand what that breakdown is there and what the buildings are. I've done this kind of looking at it, but it doesn't add up to 81 unless my math is poor. So just so we have the same terms of reference every time from where we're starting, this information needs to be disaggregated a bit more and be very clear. That's my request if I need to move that motion, I will.
I think it
So
makes sense.
I
Yep.
think it's a good direction.
Yeah.
And then I'm seeing that, so I'd like to have that, actually, I'm asking that what I don't want to have is every time we have a different
Yes.
document.
Yeah.
It's too
Yeah.
hard.
Yeah.
So if this is our baseline document, that this document be reworked to capture that,
Right.
and we continue to rework the
Yep.
baseline
Yep.
document.
Yes, we will do that.
Okay?
Yeah. And grounded in the tenants first, like,
Pardon me?
grounded in the tenants first, because some of the questions even are things that we actually have agreed upon, like the pilot was actually agreed upon previously, and just actually, we know where the starting point is.
I think if you saw, that's correct.
Yeah.
And then the chair would see that, because this is going to track with us through the whole time until something's separated out. And it's important that the board has that very
Yes,
clearly
yes.
done. So
Yes.
then I have a couple of questions. So particularly on page 10, where we have high needs buildings, which we don't know which ones they are, and because we haven't had that broken down, so I'm asking for that. We have a tracking. There's more male tenants and younger tenants. So are those people that are not seniors that have been moved into those buildings? That's my question for you and for the city.
No, that's not the case. Those are all seniors. When we refer to young tenants, we're referring to young seniors, and the men are also seniors.
How many non-seniors are in these buildings?
They're all seniors. In that, yeah, in the building, as far as I know.
Seniors.
Oh, I'm glad you added
Yeah.
that. How many non-seniors are in these buildings?
In the seniors'
People that
buildings?
have been moved in to these seniors' buildings for whatever reason, streets to homes, moving from the, whatever. How many?
Non-seniors and seniors.
Let's, can we,
So-
we'll
so let's
follow
do
up
that
on
as a takeaway
And
on
we
that.
will send it out, because I think that we'll get that information.
Yeah,
We're hearing none.
I know, but
I'm
I'm
questioning
hearing
that.
mixtures, so let's confirm it.
yeah. Let's confirm the facts on
And the
this.
process, if there is actually a process.
That'd be helpful to understand what that looks like. Then this is, some indicators did not contribute to building need. Tenant community services referrals, what would that be?
Do you want to speak to that, Chipre?
I'm sorry, can you repeat
Can you
the
repeat
question?
it, Paula, because I didn't quite
10,
understand. Yeah.
it's page 10 at the bottom. Some indicators did not contribute to building need, and there's a few of them.
Oh.
Tenant community services referrals, and I'd be
that
interested
was-
with.
Sorry, we just didn't hear you.
Sorry,
Yeah, I
that
understand.
was a technical issue. In terms of our report generating system, one of the reports that we generated from the tenant community services didn't show enough variance, so we didn't utilize that data. It's just a technical anomaly from the reports that we generated.
What kind of data did it not generate, if I could ask that?
So in terms of, we looked at a number of indicators in terms of tenancy as well as support to look at the type of vulnerabilities tenants were dealing with. So we were able to adequately identify that when we looked at AUI data, when we looked at the LINS data, when we looked at arrears data. That the report that was generated through that channel, it was just not, it wasn't useful.
So that we're clear, so what I'm hearing you say is that in determining which buildings were high need, you did not use data that includes tenant community service referrals, you did not use that?
No, we did. There's a report, but we used the report that was generated. There was a technical issue with that particular report. We did, so our AUI and Easy Track data captures referrals that are sent from frontline staff to our tenant community services staff. So that better indicated the referrals, whereas the report that's specifically generated through this channel wasn't as indicative. So we do have a way of capturing the referrals from frontline staff to tenant community services, and that's through looking at Easy Tracks. And that was a better way of identifying that information.
Okay.
And if
yeah,
I could just
that's not
add,
clear.
so low need buildings were buildings that had fewer than average calls for pest control, 911, CSU, et cetera. Moderate need buildings had the usual challenges, but they were kind of in the middle of any Toronto Community Housing Seniors building. And then the high needs buildings had significantly more pest infestations, more safety related events, more 911 calls, more visits to the ER, more arrears, et cetera. So that's how we broke out low, moderate, and high need buildings.
Okay, I'm still on this one because it's page 10 and page 9. So on page 9, we'll go back there then. This was the what was examined. Unit condition, clutter, you know what that means. Pest control, all calls. Community safety, all calls. That should be 911 and CSU. And you were able to look at all police calls?
We were able to look at 911 data, yes.
Were you able to look, 911 only, not division attending?
No, sorry, we were able to break it down from the city into police, fire, and paramedics,
And CSU?
and CSU.
Okay. Then there's arrears, then legal, then health, percent of bachelor, and staff perception. So that is what you examined.
That's right.
And then over here, some indicators did not contribute to building need. The referrals, where is that on the front page? Page 9. How is that reflected? Where would those referrals be now reflected if you couldn't use them directly on the page 9?
They're not sure.
I'm not sure.
So you said that tenant community services referrals, you couldn't use them because of a technicality, but you had another way to do it. That's what I heard. Was I
Yes.
right?
So
So
from-
then on page 9, you have the list of things that were examined. Where would that fall under that list on page 9?
So I don't think that list is comprehensive of the sources of our data. So we looked at, in terms of our sources of data, we looked at annual unit inspection data. We looked at, we have a referral system within TCHC. It's called Easy Track. So we looked at reports that were generated through Easy Track. So we had various sources that then fed up into that.
Okay, so you didn't list everything on page 9 then. You don't have Easy Track there. Is there anything else that's missing?
So I think the list that was provided is an aggregate list. It doesn't list the specific
see.
sources of the data.
But I'm sorry to be so picky, but that's an aggregate list, and then you get right down into the weeds on some indicators did not contribute to building need, which
So
is.
those were indicated as outliers. So those were issues that really didn't have an impact. That's why we indicated those.
So what's a major pest incident, please?
I'm sorry, a major pest incident?
Well, some indicators did not contribute to building need. Major pest incidents said.
So what that may be indicating is that there wasn't such a large frequency of major pest incidences in our report for it to be, to sway the data either way, to make it a high or medium or low need.
Yeah, urine and feces, let's just go through them.
So in terms of that indicator, again, it's about prevalence. The frequency, there wasn't such a high frequency that it made a notable difference.
So pest
I don't know if it's,
Pest control in seniors' buildings is a very big deal. But it wasn't part of the building need scope.
No, it was how it was captured. So again, pest control would have come under the annual unit inspection data. The way it would have come in, we would have captured it through the annual unit inspection
Would
data.
it not have been, sorry to interrupt, sorry.
And also, we also use the environmental health services data to look at the prevalence of pests.
That would be the number of visits to a building?
The number of units.
I'm sorry, I can't hear you.
The number of units with pest issues.
I just want to find out how you got that data. The number of times someone was called to a unit and treated it, is that how you did the data?
or the number of units.
So we looked at the prevalence as well as the frequency.
The prevalence and frequency, and did you use Easy Track as well to?
Yes, that would indicate the number of referrals and the type of referral.
So what it looks like is that pests weren't considered, but in hearing that, pests were considered in a whole different way. So I'm having trouble with laying these out, looking like these things weren't considered, when in fact, you've considered them in a number of different ways. Number of times that someone's gone to a building, number of times they've gone to a unit, number of times that Easy Track has been called. I'm clarifying with you that that is your data source.
And is your concern, Paula, that because they might not have had the right data, that the buildings may not have been coded properly? I'm just trying to,
Well, seeing that major pest incidents
Right.
aren't a contributing factor to building need,
Right.
I'm concerned that that should be a factor.
that's what I.
But it's somewhere buried somewhere else and taken as information. So it looks like there's no pest problems,
When there is.
seniors portfolio.
Okay, yeah,
It
yeah.
looks like to
Okay,
me.
I just, yeah, okay, that's,
Councilor Fletcher, I think the issue is The indicators that we have categorized as outliers, that may be posing a little confusion.
Yeah.
Yes.
All we're trying to, so we're not saying that that we don't have pest issues. We're just saying the sources of particular reports may have not provided us adequate information, but we did, I want to ensure that we did look at pest issues, we looked at arrears, we looked at unit condition, we looked at,
I hear you.
yeah.
But this says it didn't contribute to building need. That is the headline here.
Right, so it's, what is it, I guess what it's missing is that a particular specific report didn't contribute adequately to swaying, there wasn't enough adequate data within that particular report. That's what it's saying.
But just for clarity here, just to get,
My hair is gonna start on fire around this table.
Paula, can I just get one clarity piece here? Pest issues was a factor in assessing high-needs buildings, which I
Yes, it
think
was.
is the point that you were concerned was not considered.
Yes, it was.
There's one report where there was some technical issues that you couldn't use that
I
data.
can't hear you.
I'm just clarifying that pest and incidence of pests in buildings did actually contribute to the low, medium, and high.
Yes, it did, through our AUI and our Easy Track data.
Right, because, so in some ways, we're getting a lot of information, like, so I think maybe we need to clarify that.
Yes.
Is that, so that's what you're saying, though?
Yes, this is what I'm saying.
Yes, so then I'm gonna ask that be clarified in this report,
Okay.
because
Yes.
it,
Right.
technically,
So-
when
We
you
will do
just
that.
read it, you think,
Yeah, so
well,
if you
there's
can,
no problem
yeah,
here.
because I think that, like, we're getting into something in the report, but we want to make sure that, that this is actually a factor in these buildings. So you'll confirm that with us?
Yes.
And how major of a factor.
Right, right.
In determining need.
Right.
It says it doesn't determine building need. I'm pretty upset about that.
One piece, right? So what are you saying?
We will do that.
Yes,
Yep.
we will clearly articulate the frequency and the magnitude.
It's
they'll
hard-
follow back on
I'm
that.
sorry, it's such a hard room. When you cough, I can't hear anything.
So the frequency, so they will come back and clarify, and the report will be amended so that we actually have this in a more clear direction.
That would be simply fantastic. Thank you very much. And just those buildings, we're going to break those out,
Yes.
and
we
how
would agree.
many are in each area. And I guess I'm going to follow up on somebody else, because the high needs buildings are all in that central zone. There's more yellows and reds than anywhere else, I think. Or maybe not, there's more reds.
Last one.
I don't know how it's broken out. So
We
again,
will
I'm
also-
having trouble because it's not listed.
So it'd be
By
great to
zone.
have more detail on the actual.
On the maps, yes,
Yeah,
we can
on the
break it
maps.
down
So
by
they're,
number, the
but you
number
have,
of
you have
high,
that too,
medium,
right?
and low building, yes.
Yeah, it's kind of like the balance between how much material we provide at these board meetings, but I think this is really relevant.
I'm going to say that this is going to be the anchor document
Yep.
and for us to travel with on
And
all the
let's
buildings.
fill it out.
And so we just need that laid out in a way that everything matches one another.
Yeah,
Yeah, that would be helpful.
great. Any other, because there's a few other items on the agenda, and I know we have a hard stop at probably just after 11. So if there are other questions, I don't want to actually shortchange the conversation. This is
I don't
actually
have a
critical.
question. I just think that Ms. McLeod wrote in a deputation for item 6, but it's actually item 5. It's all about pest control. Anyway, somehow it's under item 6. I don't think she's here, so, pardon?
That deputation had multiple issues.
Yes, that's one of them.
And she couldn't be with us today, but we are addressing those issues directly with the tenant, including
He
the
has
pests.
listed everything in the building, 15
Yeah.
cases of pest control gone wrong, people sitting with, I mean, I would like everybody to read that.
So I think
deputation.
pest control probably needs to come back to our next meeting to speak to that deputation and your concerns that you've raised. So we can do that as well.
So I'd like to refer her deputation to the next meeting as well, please.
Okay?
And if I could just add, so we have worked very closely with the Toronto Central Lynn and their data analytics people, and the city and their data analytics people, and Toronto Community Housing and their data analytics people. And If you, Councillor Fletcher, or if the entire table would like us to come back with a more detailed approach to how we got to these buildings and what we looked at, we'd be happy to do that.
That would be a great appendix, actually, to
Yeah,
this
thank you.
report.
Thank you. And, you know, I know that, like, we would love to actually move to intervention. This is actually one example from my perspective, taking my chair's hat off, where we're actually doing things in a more evidence-based manner, in an integrated manner, and I'm actually encouraged by that, because this is actually, we have had habits in the past where we actually just do an intervention and we haven't evaluated, and they don't always, it hasn't always been successful, and we haven't actually had this kind of integration, you know, at a very timely period of time in terms of our healthcare system also reforming. So I'm actually quite encouraged by the work underway, and that you actually could answer as much as you could, because we haven't also sometimes had that level of data. It's a starting point. Yeah.
Just a last comment. I think from the questions, you'll see that communications out to tenants are critically important in terms of why it is you're starting with medium buildings as opposed to the high-need buildings, so people don't think that they're being forgotten.
Yeah, and that has been, like, I think we have to remember here what we've actually communicated, because this has actually been the plan, and you know, a reported plan going forward. Okay, so thank you. If I can ask for an approval of this agenda item 5. John, seconded. Amanda, all in favor? Thank you. And we move on to the tenant engagement refresh update, and I believe we have a deputation. Yes? Or no? And on 6, so we're okay for 6, we do. Okay, so please note that the deputation that you have from Ms. McLeod, she can't present it, but we have it, and we will follow up with that. Is there, and on the engagement refresh, Sheila?
So I could give a brief overview, or we
Yeah,
can move to questions?
I know people have actually, hopefully people have had a chance to take a look at this. This is another item that I would say has been very critical to this table and us keeping on board. Maybe a few sentences in terms of anything that's updated from, because I know that Sheila, you've been doing a lot of work on this.
And we have staff in the room who can speak to it as well, but just by way of overview, our communities are actively engaged now in selecting which option, tenant engagement, they wish to move forward with. We have a brief update in the report, page 2 of 3, as to why Regent Park, because it falls under a social development plan, is not participating in that 4-choice selection process. And we are also actively working, once we've completed the 4-choice option process, to have a company-wide election early this spring.
Great, thank you. Any comments, questions? John?
Just a quick comment. I was invited to attend one of the community sessions at Maybell, and your tenant service coordinator was excellent.
Yeah.
And there was about 10 members from the community there. It wasn't a huge group, but very well-engaged people, and I just thought that the manner in which your coordinator explained the new sort of paradigm and what needs to happen and how it will benefit them going forward was just bang on. It was just really, really good.
Good to hear.
So I thought you'd like to hear that. It's always good to hear good news.
Thanks, John. I would encourage anybody that if you do get a chance to actually go out with Sheila and her team for the engagement sessions, I actually am hearing very positive feedback around the level of discussion that is happening at that local level, and I hope that we'll see more of that in the spirit of some of the deputations that we've heard in terms of how we want to be with one another. Anything else on that? So can I have an approval of the tenant engagement update? Debbie, Uba, all in favor? Great. We have a deputation on the next one?
You on item 7, it's Ms. Wilkins.
Catherine? This is the approach to the CCTV cameras. It's an action item arising from the June 27th board meeting.
Yes, thank you. Looking at this report, you know, in previous committee meetings, we invested literally, what I don't see in here, literally millions of dollars in this, you know, modernizing the recording systems themselves and placement of cameras. I don't really see that reflected in this report to understand what's gone into, it's not just some cameras sprinkled around and we're having a conversation, literally millions year after year to get to where we are with today's CCTV system. Now, what I'm not sure of, and often this happens, what we see in reports that come to the board and the committees is not what we live in our actual community. So the lived experience and what we hear here are very far apart. And so you start to wonder what's real and what's forecast to be real. So in the case on page 2 where you talk about CCTV camera deployment model, where it says we have designed a deployment process that will be consistent for installation, height placement, camera type, et cetera, et cetera. What I'm not understanding, is this a new process that's going to be implemented, or are we telling the public it has been implemented?
Yeah, why don't you just answer it?
We have a standard that we are implementing, and we have been for, as you pointed out, Catherine, for a number of years, 12,000 cameras across the portfolio.
Right. So what I'm saying then, because I don't like to center out specific communities, then we need to go back and double check what these contractors are doing, because I can reach the cameras in my community and I'm 5'4.5". So I'm pretty sure that's not our new standard for height placement of cameras.
It's very situational, dependent on what we have to work with, but if you have a concern, call it in and we'll
I'm
look at
fine,
it.
it's just this report leads me to believe that we've got new standards, because we're protecting the millions of dollars we've invested.
Correct.
So that they cannot be vandalized. But if you put them within reach, vandalizing is very much a reality, right?
Yeah, correct,
That's-
but when we
that's-
have a ceiling height of 2.5 meters, it's hard to put a camera in a location where it can't be reached. So it is a
All or nothing.
bit of a, we've got to adapt as best we can to existing situations. But if there is a concern, call it in and we will address it for sure.
No, I'm just saying, you need to go back and
Yep,
check that
we
your
will.
contractors
Yep.
are doing what you believe they're doing
Yep.
in our communities. I'm thrilled with the cameras we've got in our communities, I'm not complaining, but I'm suggesting that what I'm reading
thank you.
isn't in fact what I'm living. The other thing, and it has always been a concern, but I see that's what this report is about, we have never included tenants, as if their input regarding safety in their communities was irrelevant. So it's really nice to hear that in 2020, we're actually going to include tenants about safety issues in their community, because we don't live there as staff and as management, as directors. It's the tenants who live there. They know where the dark corners are. They know where the antisocial behavior and vandalism and such takes place. So I'm pleased to see that we are going to start including tenants in that process, but I do think when we talk about the tenant engagement piece, because it says beginning in 2020, it says we're going to take a proactive approach and include tenants. But I think we have to be realistic. We've already said we've got cameras in every single community as is. No tenants were consulted on those, except perhaps in a high-needs community.
Exactly.
And that was the only time where a conversation might have been had.
Yeah.
So I just want to be mindful, are we saying that we're going to include tenants in high-needs communities only because we don't have the staff or the resources to go to every single community and do an audit and do a walk-around? So I think we should define, is this high-needs communities only, or as needed even, as on demand?
So it will,
It's okay, we'll
Yeah.
follow up on that.
Yeah.
Thank you, though.
Okay, and on page 4 of 5, this report is very useful, but I find it's very different from previous reports we received. There's no mention about my favorite thing I always brought up at this table, was the use of covert cameras, where we want to catch that antisocial behavior, but it's not going to be caught on the second floor stairwell if our cameras are only on the first floor lobby.
Great.
So I still think, and I will, till my last breath on this earth, that covert cameras could really be knocking down the vandalism, antisocial behavior, and criminal activities in our community. So I think there needs to be consideration when you're investing those millions in cameras, consider those use of covert cameras. I'm not suggesting you put up an announcement.
Thank you, Catherine, you're over 5, so.
That's right, that
yeah.
you're using them.
Yep.
Okay, just let me run down this then. So there's
quickly,
no
please.
mention of the costs attached to the cameras or installation and the repair of these cameras, which is not very timely. And as I suggested earlier, doubling back to see if the cameras have been installed to our new standards. Thank you.
Thank you, we'll take those recommendations. Are there any other comments? Uba?
And the only comment that I will make is I think it's a good idea if we're gonna spend that much money to install cameras and to improve things, to put them, as Catherine said, where people cannot reach and spray.
Yeah.
That's one good idea. The other thing is, I still, again, agree with her. We all work in the betterness of our tenants. That's why we're all here. So when we are talking about safety that concerns them, they should be part of that consultations.
Yep.
Yeah.
That's great. So it looks like we're moving in the right direction, and I think even when we can't meet expectations, that we're actually really clear about that too. Is there any other comments on this? Because I think it flows nicely into the next item. John?
Quick question. We have 12,000 cameras. Do we have a means by which we track how many are defective?
Yes, we do.
And how many are defective approximately?
So every day, our superintendents do a walk, call in what is not working, staff are dispatched to fix it. So I could pull
Okay.
those stats if you wanted to see.
Do these cameras have a long life? I would think they would have a long life unless they were vandalized.
They have, exactly,
Vandalized.
they have a long life, but they are frequently vandalized, especially in corridors where the ceilings aren't high, we put the camera up.
Right.
And it's
Yep.
sprayed.
Got it, thanks.
Great, this kind of fits nicely into the next item. So if, with your indulgence, if I can get an approval on this one, we could move on to number 8, which is the violence reduction. Can I have an approval of number 7? John, Amanda, all in favor? Thank you. I like to get it spread it around. Anybody for number 8? Okay, so for number 8, I'm gonna suggest that actually people have read the report. I know that it has been an extensive package, and that we look at questions. This is the progress report and performance measurement that was deferred from October. Yes, Paula. So you have had this twice.
I think we should have this pretty regularly.
I do too.
But two things. We were to have a presentation as to what SDFA and the TCHC was doing. So there's an MOU. I'd like to see it. We should have that tabled here as part of the report.
Yep.
What is the funding that's, it was supposed to be in 2019, actually, the
yep.
funding?
Yep.
How much is funding that's supposed to go to the VRP programs through SDFA?
So I will ask Nadia to answer that question. For 20, sorry, for 2019.
It's only 2020 here, so what is that?
2020.
I'm Nadia Gavaya. I am Director of Program Development, and I've been working with the SDFA staff to put together the joint proposal. We are going to have to retool the actual amount of funding because we want to map it into the new structure. So the idea around the funding going to SDFA is that there would be flow-through funds for community agencies to parachute and do programs in the communities, as well as for tenant groups.
I want to know the number. It's a budget number that we gave. We gave $5 million, and part of that money was to also have programs. So how much is it in the budget that's associated with this?
So there was $40,000 per pilot project, totaling $120,000 for 3 pilot projects. And then we looked at an additional, I think it was $35,000. So I can get you the MOU and the breakdown of the actual funds.
Yeah, I think these are supposed to be aligned, so
Yes,
that was 120 and then another 35. What are the projects? Let's dig into that a little more. And then for the deployment, by building, we should also.
You want to know
I guess I just ask, for the deployment for the building, have you seen a reduction where we've had pretty serious deployment?
So Bill's here and can answer that in detail, but I will say in Dan Harrison, we've had a significant increase in the number of calls that have come in, given that the community now feels that if they call, action will be taken. And I'll let Bill speak to the broader question, but I would say in response to the question that you asked about 2019 and how we're dovetailing that into the plan with SDFA, you will see in the 2020 budget the same type of programming that's going into the other VRP sites and an expansion in non-VRP sites that have high youth populations. So we can walk that through with you.
But I don't want to do that through the budget. I want that, it wasn't a budget item, it was to be set out.
Integrated.
Yeah, so we have it for 19 and it's integrated also into the 2020.
We'll make sure you get that. Yeah.
Well, I'd like it here.
Yeah, I mean that here, yeah.
Following that one. Okay, that's good to hear that that's successful.
Yeah.
Number of calls is up, but that's the good news, right?
No.
Yeah, that is the good news.
Yeah, John?
Question for Bill. So it says since September 2018, third-party security guards have been providing security in 10 high-needs communities while additional special constables are recruited. So I'm just wondering, has there been an appreciable, can you speak about the change that has made in those buildings with, I guess, sort of a reinforced security presence?
Yes, so sorry, is this on?
Yep.
I believe it's the second chart, just the broader 10 communities and represents 2 quarters. And we see the differences in there is the bulk of those communities.
Oh, this is the 10 high needs, this is the 10, here it is here, okay,
Yes.
all right.
So you have now permanent third-party security on site with limited powers, acting as agent of property, predominantly intervening trespassers. That in upon itself gives us positive results. When we implement the special constables onto site, they have additional peace officer powers and patrol broader beyond the capability that security guards have. And that, of course, leads us into, as you see in Dan Harrison, is increased engagement, increased encounters of trespassers or persons there for unlawful purpose, resulting in higher arrests. In some cases, some of those arrests, in addition to the increase in calls because we're on site, and instead of having to drive across several communities to respond, in some cases like Dan Harrison, somebody's only 4 minutes away, people feel more comfortable calling and getting a response than they did traditionally. On top of which, one of the things that we've noticed is, as part of engaging persons present for unlawful purpose and making arrests, what falls under that serious violent incidents is when those arrested persons are in possession of, for example, edged weapons or a weapon of opportunity as well. And unfortunately, but it's a reality, is in some cases, on several occasions, we engage these persons who shouldn't be there, make the arrest, and they resist. That leads into assault category for resisting arrest, which gets captured under the serious violent incidents category.
Oh, it does, because I
And there's
mean,
an increase there.
So I mean, at the face value, it looks like we've increased our presence there, and the serious acts of violence has gone up, and you would hope that it would have gone in the other direction.
Well, let me speak to that, because I can use Dan Harrison as a particular example. The serious acts of violence were already taking place. They weren't getting recorded. What we have seen in Dan Harrison, which is probably the most glaring example, is there's a tripling of engagement of activity, calls to CSU, trespassing, incidents, serious violence incidents that were taking place. Because you have a presence on there, they can witness it and they can address that. So you will see first that there will be an increase, and then over time you would expect a decrease.
So then at what point in time will we start to see a decrease and a safer community?
So the expectation, the typical response is that these things occur in a bell curve, and based on the dynamics of the community, the size of the community, the phase-in, there's a number of variables. But we monitor it to see where we hit the new baseline, take our measurement from there. And I'm not confident we hit there with Dan Harrison quite yet, but I think we're almost there. One of the things we did is using that as a pilot for best practices, and what we learned out of it was we doubled the staffing in the summer to deal with the number of antisocial behaviors that we knew it historically existed there. And in doing so, our engagement and our arrests went up, our malicious fire alarms went down 25%. So you can see the variable, the impact of the presence across the spectrum when it comes to the statistics.
So the arrests, these result in police charges?
Yeah, so as peace officers, the special constables make the arrest, notify the local police division, who confirm the necessity to transport or release on scene. We engage them in the court process. If they're released on scene, they're engaged, they're issued what's called an appearance notice and directed to appear before court, and we swear to those documents. In many cases in our communities, these people are not releasable, and we actually transport them. Our cars are fully equipped cruisers, and we carry the powers of police officers on in relation to our property, and they are taken by our cars to the police divisions and booked in, and either released through the officer in charge or held for a bail hearing.
And when an arrest is made, we would know, we probably keep track of the number of arrested individuals who are tenants and those who are not tenants?
Yes, it's checked off within the court report.
And we keep track of the type of arrest and the nature of the arrest and the nature of the incident, I guess? Do we have statistics for all of that stuff?
Yes.
We do, okay. Thank you.
Other questions? All right, so we will, this one, as Councillor Fletcher suggested, is something that we want to keep tracking, and hopefully we will see that bell curve at some point for some of our buildings. Can I have an approval of this agenda item?
Terrible. So moved.
John and Amanda. Michael, are you still on the phone? Okay, so Michael's not on the phone anymore. Okay, well, all in favor? Thank you. We will move on to the vacant unit action plan. Can I ask, we don't have 45 minutes for the report, but I think it's really important that any context before we actually start the discussion is actually what do we need to actually be thinking about, and the background to this report. Oh, and we have a deputant, Catherine. We're at number 9.
Tenants have to come with what they want to say on a few things. Do you know what I'm saying?
Thank you. I suggest we're not all 6 feet tall. I'm on my tippy toes.
Pull it down.
So on page 2 of this report, I think it would be helpful. It seems as every passing year, the information and the metrics that come to the board and the committees is less and less. And so in this instance, as we talk about vacant units, I think it's really important, particularly for new board members, to understand when we talk about members of vacant units, what are they? Are they bachelors? Are they 1-bedroom? Are they 2-bedroom? Probably very few of them are 3-bedroom, but instead we just have something that says vacancies. So in helping the board to understand the magnitude of having vacant bachelor units for so many years and coming up with a strategy to address that, so it becomes an awareness in the board's mind. Then on page 3, when we talk about the uninhabitable units, you know, it certainly raises the question as to how long have these units been uninhabitable? Why are they uninhabitable? You know, with the funding that was provided from the City of Toronto, our goal was to be reopening uninhabitable units so that anything that had been closed down, we now had the funding to reopen them and put them back out there for rent. But I don't see anywhere where the board or the committee is ever going to hear how that's progressing, rather than just see a number that's uninhabitable and not know whether we are investing in these units, because previous management did not feel it was essential to invest in units, and it was easier to close them, and they didn't feel that was a good use of our resources. We have resources now. There's no reason we cannot bring them back online, and families are living in shelters waiting for us to do so. And on page 5 of 5, and I think this flows into another report where at the very bottom we start talking about city staff and the referral agreements. It's important that tenants themselves know what the service delivery expectation is for these referral agreements that live in our communities. And it's important that we circle back and say, are you being served? Yes. Are they doing what we think they're doing in accordance to an agreement that tenants have never seen? And so, and I will also never change my mind on this, but on page 8 of 9, where it says staff are working to formally define the criteria that would limit future use of units for storage. How about 0? How about there is no criteria under which we would leave people living in shelters so that we can store some supplies in a unit they could be living in? And I think ultimately, that's our goal. No unit should be used for storage when there's families desperately waiting for housing. Thank you.
Thank you, Catherine. And I'll open it up to Kevin and Sheila. Is there anything that you want to actually comment on very briefly?
So if I could just give a very high-level overview, right? So we are making steady progress in reducing vacancies. You can see in October 2019, down to just over 2%, 2.01. The vacancies that we have in 1 and 2 bedrooms, and we have this very well documented, will be consumed by the overhoused tenants that we have that are looking to move to right size to a 2 and 1 bedroom. So we have more overhoused tenants than we do 1 and 2 bedrooms to accommodate them. And we're moving through that process. The opportunity that lies ahead of us over the next quarter to reduce vacancies is in our bachelor units. So we have a push on right now through the additional staffing that is being hired to make more offers for those bachelor units. We are also working with SSHA on a strategy to ensure that when those bachelor units are offered to tenants, that they have the right supports and are able to function successfully in those units. So at a very high level, that's where we're at. Vacancies are coming down. We won't see a lot of movement in the 1 and 2 bedrooms because of the overhouse coming into those units, and we are focusing over the next quarter on bachelors, and we should see some significant movement there.
Okay, thank you. Comments, questions?
Just a quick question. Are we still doing?
Can you use your microphone?
Are we still doing the base choice pilot projects that we did in the past, or?
So I'll ask Patricia to speak to that, but I believe the choice-based program is rolling out in the summer of next year.
So we've had, hi, my name is Patricia from our operations team. And so in our discussions with the city, there is movement towards the choice-based letting program. So that is with our city partner through Housing Connections. And they've given us some preliminary timelines, and it looks that by mid-year next year that initiative should be moving forward. And in line with that, as a housing provider, that uses Housing Connections to fill our vacancies, we would be aligned with that process.
Because that was successful, I think.
Thank you.
Thank you.
Paula?
Just a question. First of all, it's helpful if we have the numbers, so we understand how many RGI units are.
Turned on, now it's on. When we're dealing in chart, how many RGI units is that? Yep. How many market rent units do we have? So we are clear on
I agree.
aggregate numbers. And vacant rental units, how many of those are market? How many of those are RGI?
Right.
And then we know at the 0.99%, you know, I've asked over and over again how people get a market unit in Toronto Community Housing. Still don't have that one. I'm very interested. When I go over to page 3, I'm looking at revitalization under construction. Those are ones that are being rebuilt as because of a revitalization. Then to be demolished, I'm going to assume, maybe wrongly, I'd like to know, those are also related to a revitalization.
Yes, they are.
And then relocation, that's also related to a revitalization.
Yeah, those are units that are held for tenants that are in a
But it's related
revite
to
area.
a revitalization.
As is the newly built as well.
Okay, so of those 1,346, 1,345 of them are related to a revitalization.
Yes.
And that is a lot of units to be out of circulation closed. And I'm wondering if we've looked at what our revenue losses are for those units that are out, because that's a factor as far as redevelopment is concerned. We are losing money for income for redevelopment. So I'd like to know what
Sure,
that
we can
is
provide that information.
month over month. Maybe it's not a lot, or maybe it's significant when there's 1,300.
Yep.
That's about 4% of all of the units compared to
Yep.
1%, 2% that are vacant. So when we add that, just doing that, right? Because those aren't counted in the vacancy rate. Correct, Kevin?
That's right.
That's correct.
The relocation ones. And then you've indicated that you're looking for some of these, I don't know what they're called, but so that we're not using units for storage.
Like trailers.
But tenants also, and it's an important, I think, part of violence reduction, in smaller places, sometimes they have a unit that they're using for different reasons. To be able to have a place to store or do things from, that's a factor for those 54 community programs. Should we be keeping those or considering them as an important factor within tenancy?
And that's essentially how we would look at it, because there are a number of buildings that were built that really didn't provide for sufficient community space for tenants.
And they're an important part of keeping the community together, tenant
Yep.
engagement, and
Yep.
community safety, really, at the end of the day, when people. So probably those 54, we would say, we're just going to park them.
Yep.
We're not trying to get rid of them. Okay. So I'm just interested in what the cost is, because we should try to recoup some.
Sure, we'll
that.
give you that information. We'll report that out.
Thank you very much.
Good questions.
And when am I getting my market unit rental?
Yeah,
process?
we'll send something, if we can find that process, and, because you
Not
asked
today.
that. You asked
Not
that at the
today.
last.
Well, we're
meeting.
going to start that in terms of publishing the availability of market units on a consolidated basis in Q1.
Yeah, but I want to know what we've done.
Yeah, fair enough.
So we'll bring that
would be
back.
great.
Anything else, or can we pass this? Okay, so we'll move this item. Thank you, Paula, seconder. John, all in favor? Great, and we will move on to the, thank you for that work. I think let's continue to actually have this material, because I think we want to actually follow the metrics on this. Update on tenants first. No applicants.
And I will take the report as read, and Scott is here to answer any questions if you have.
And I think the point was made well, that tenants first and the seniors are intimately connected. So I think we will recreate our agendas in the future to just remind ourselves where we're at, and even, in this document, there's also some progress. So it does actually align with the seniors. Any questions with regards to this report that Scott or
Single family, is the transfer zone? Oh, transfers are down here on that.
Yeah,
piece.
no, this is actually on the tenants first.
Yep.
So this is just an update, and we will continue to update the committee, and if there's anything in between that people feel that they need more information, I think your point in terms of having the city manager or the deputy city manager come and speak to this would be helpful too. So I'm assuming that we're okay. Can I have an approval of this item then? John and Paula, all in favor? Great. Use of space policies is also Scott.
We do have two deputants versus Mr. Loman.
Two deputants on the use of space policies. Mr. Lohman?
Good morning, everyone. I didn't write anything down, this will be brief. Over the years, there have been many issues about use of space. And a lot of it seems to be the follow-up and the actual control of the rooms. When it comes to the exclusive use over the years, there have been many, many problems. Where it's almost an overreach by agencies. I'm very pleased to see that what is written in these policies seem to be pretty comprehensive.
Yep.
But like many things, the devil is in the application and the accountability and the follow-up. The one thing that I would point out in both of these applications where it is speaking about the related policies and procedures that were used in the creation of these policies is the tenant charter is missing. Tenant charter is not in either one of these. And it seems to me that that should be one of the foundational documents in terms of engagement. Particularly when it comes to these public or non-residential spaces.
Yeah, excellent idea.
That's why the tenant charter was created.
Yeah.
So I would like to see that being included into the policies that are being followed in this. And I would also like to see some sort of mechanism where there is an accountability over the buildings, because not all buildings are going to be following the exact procedures, and there needs to be something in place to assure that tenants do receive the best advantage, and that the benefits are for tenants, that they meet tenants' needs, and they best serve Toronto housing community. So, thank you very much.
Thank you.
Thanks, Bill.
Yeah, and I think the tenant charter, it's a really good idea with a lot of our policies to anchor that in there, because it's actually, that should guide us, right? I saw a lot of nods around that. Next item, Catherine.
On page 2 of 6, I was actually at the executive committee when councillors Nunziata and Pasternak raised the issue around Toronto Community Housing leasing arrangements with these agencies, and that they were raising them so high that the agencies may not be able to continue providing services in our communities, and that is where this came from. They're providing us a service, we need to be cognizant of that. We want the service. If we price the rental of the space so high, obviously they're going to discontinue providing services. So I think it's a good thing that we're being mindful of that. On page 5 of 6, where we talk about, and we've been hearing it for years at this table, that tenants feel they're facing barriers to their community spaces, and indeed, in many cases, they are. Back in the old days, a simple verbal request, is anybody using the community room on Thursday night? Some tenants wanted to get together and play cards or something. But it's such a complex process now. You get a written report. It has to be evaluated by risk management. Is there any risk to tenants meeting in the room between those hours? I think we've gone too far. We've just gone way too far about making these spaces accessible. We have a list of items that are not a risk to do in these community rooms, and I think we should consider if any of those 9 things our tenants want to do in their community are not a risk issue, then why are we making them jump through hoops to go and have a tenant meeting? There may be an issue arising in the community, and you want to get your tenants together right now to talk about that issue, but it's a process. By the time you get through the process to ask permission to use the room, you're really not even going to bother having a meeting anymore. But one thing I do want to say about these community spaces, over the years, we've had audits done of these community spaces, and for various reasons. And it's kind of funny, because what we've never really done is actually assess to these rooms to see that they're even worth renting. And so, we need to do a real audit. We need to review, what's the state of repair of these community rooms? Are there adequate number of tables and chairs when people rent those rooms? Is there air conditioning? Many of our rooms are not air conditioned, therefore people would not want to rent them in the summer months. And I know we don't want to talk about that, but I'm just throwing that out there. We should be posting the fire code requirements for maximum number of persons allowed in these rooms, seated or standing, because the numbers vary. The other issue we have is, for places like 341 Bloor Street, commonly used, a lot of community activities, agencies, events and such go on there. There is not an intercom system to buzz someone in that community room, say you're going to a party. There's no way for you to let the people in the party room know you're in the lobby. Because at some point, somebody came along and said, oh, we're not going to spend the $7 a month it was costing us for a telephone line to buzz into that room. So we need to think of that as well. I think it's worth the $7, so you can buzz your party and let them know you're in the lobby and they can let you in. Even here, someone's got to physically get up and open the door, but at least you can see them here. The other issues that need to be considered is there parking at these community spaces that we want people to rent, yes or no? And is there curtains, simple things like curtains or not? So we really need to do a better audit of these recreation rooms and make sure they're up to our standards that we would feel comfortable ourselves renting. Thank you.
Thank you. I had one question. Was there another deputation on that? No. One question in terms of just actually the agency. This is another area where a lot of our policies, a lot of our agreements were very out of date and we weren't staying on top of it. So I appreciate that the work that's been done. I wonder how the agencies have actually responded to the work. So there was, I know some of us were actually being asked about that and actually the importance of actually having some of these services in our spaces.
So I'd say that this policy requires further improvement. So to your point specifically, the agencies are not yet fully satisfied with this being a smooth process that allows access to our spaces. We have done a lot of work to manage risk in the past to make sure that we're bringing safe activities into our spaces, but that comes with a lot of steps. And we need to, I think, take an approach that balances risk of risk in the classical sense that we're looking at with the risk of inaction, or the risk that we're not going to get the benefits of services for our tenants. So that is one of the themes that I'm looking at as this is being reviewed going further.
So having a standard that's so high that the agency's also not going to actually be able to meet that, right? Yeah, that's what I've heard. Other questions? I know, Debbie, do you have any?
No, I was going to ask you what sorts of recommendations the agencies are making in terms of streamlining the process. What I've been hearing is that the process has become so onerous that folks may not be bothered.
It varies widely. I mean, frankly, as a general theme, the agencies would like as many, and if possible, every step removed from the process. We're in the process of attempting to evaluate which of those steps could be removed. But I think in an ideal world, from an agency perspective, they would roll up and say, hey, we recognize there's a need in this building. We're good people. We want to help. Can we get a key to that room, please?
And clearly tenants have similar concerns as well, that if there are very basic space use needs, why have to go through this long process that by the time they get permission, the issue has passed or they've lost interest?
That I would say is one of the central areas of improvement for this policy. A concept that wasn't well reflected in the policy when it was written is the idea that there's a distinction between common areas and what I'd call administrative areas in the building. These are non-residential areas, but from a legal perspective, they're fundamentally different. A common area is an area that tenants have the right to enjoy as part of their lease. They are, in effect, paying for it already as part of their rent. That area is not ours to dispose of for rent to some third party. Our role is twofold. One, to attempt to balance competing needs between tenants. I want to have a birthday party. I want to have a reading club at the same time. We have to figure out a way to balance those needs and to program those spaces consistent with tenants' desires. Administrative spaces are spaces that we own. The most obvious example would be a superintendent's office, but there's spaces where this concept is ambiguous. There may be a room, an empty room, which has been locked for years and which, frankly, no tenant has a reasonable expectation to be able to access. That's an administrative space for us to dispose of as we see fit. We may see a tenant need in the building that we want to program that room, open it up to tenants, but it's our job to plan that and to think about that from a corporate perspective, what are our needs for our space.
When do tenants need to have insurance to use space?
So under the current policy, it looks for insurance when there's an exclusive use, but we do need to evaluate that further. The rules around the disposal of common areas, which tenants are already, like for all intents and purposes, your lease is already a use of space agreement. Those rules need to be reevaluated.
That was my concern, that if it's common space that's already being paid for, why would you need insurance to use it?
And I can only say that I look forward to reviewing those in further detail and reporting back.
So I think we're seeing some progress, but you will continue to be updating us on this. But with the principles, what I'm seeing around the table in terms of nodding is that common space and having our tenants at the forefront, also with actually services that would be helpful to have in the building, kind of balancing all of that out. But it's very complex and we need to get on top of it and at least be clear in terms of the expectations. Then you can actually, some agencies I would say, wouldn't just want to pull up because there would be a risk to them too. Not every agency is the same, right? So, yeah.
Yes.
Yeah. Okay. Any other questions? This flows nicely to the next item. So, can I have an approval of this item? John and Debbie, thank you. All in favor, thank you. And our final item is the support for agency referrals. And just to set the context again, so that we all know why we're actually looking at this policy and what it is. Do you want to just give us a few sentences about? Oh, there's a deputation. Okay, Ms. Wilkinson. Of course. Okay, thank you. Okay, and Kevin will do that.
Yeah, so this also flows nicely with the report we just talked about. It's the first time I've actually ever heard how many units, the total number of units that are being used by these agencies in the history of Toronto Community Housing. So 403 doesn't seem like a lot, but it probably is. One of the things we need to consider in this, it's fine and dandy, we enter into an agreement with these agencies, but we don't circle back to ensure that they're delivering the services according to the agreement.
Yep.
We don't circle back to the recipients of those services at any time and say, how is your service? Is it being delivered? Are they here twice a month like they say they will be? Are they assisting you to the best of your ability? Do you think you need additional support? Is it alternative agency or whatever? So we need to consider tenants in all of this as well. And I also suggest that this report should also go to the board of directors now for their information, given that it was an issue before the executive committee. We should be letting the board know that we're on top of that. And the other thing that plays into this is looking at some of the services, how we've identified, briefly the services and such that they provide. There's not a whole lot of, there's some that are on site for specific reasons. We also have, speaking about the seniors buildings, we have tenants who are not seniors in a seniors building with these agencies. So that there tells you it's not all just seniors in a seniors building. And as we talked about earlier, and there was a very graphic presentation made to the board about a client at 341 Bloor Street, it just so happened that address, where the previous board of director was nearly killed by a client in one of the, an agency unit. So they're not carefully monitoring the clients they have in our buildings. And when they start attacking our tenants, we need to circle back and say that's not acceptable. And I hear that it's not an isolated incident, which you could easily believe, because if they're not regularly monitored, they're obviously could be wreaking havoc for the social housing tenants that live there and pay their rent. So we need to carefully consider the agencies we're working with and hold them to a higher standard of service delivery. And we also need to say to the rest of the tenants who live in that building, here's how it's going. If you have any issues with what this agency is doing, call this number, let us know, so we can nip these things in the bud before somebody gets beaten to an inch of their life by a tenant in one of these agencies. Thank you.
Thank you. Kevin, I think you're going to set the context.
Yeah, just in the context, and actually, Catherine's deputation kind of leads in very well to what I was going to say. These referral agreements have not been looked at in a long period of time. A number of the actual agreements themselves are expired. A number of the agreements predate from the pre-existing agencies that came together to form Toronto Community Housing. So the work that we are doing in this regard is really to actually make them more accountable and actually define what they are doing. I appreciate that this may be one of the ways that non-seniors are getting into seniors buildings, and certainly if it's a seniors building, it still should be seniors, and agencies need to respect that. And so, and we'll open it up for questions, and Scott is here for those. But essentially what we're going to do is, in the same way the use of space agreements has been long overdue for a really good, robust review and refresh, we're doing the same thing here with these agreements as well.
Scott, how do service agencies know that TCHC have these agreements? I'm thinking particularly of ethno-specific organizations.
So we're not actively marketing this to agencies or promoting it to agencies. Whether or not we would do that in the future is an open question. We're looking at this policy. For example, it might be prudent to build a structure based around open procurement. We have needs in a building. We would love to have an agency that's in there, and we're prepared to give up 6 units to their clients to entice them in to establish a permanent office. We could RFP that for whatever that need happens to be. That's one of the concepts that we're examining. But as it stands right now, we're nowhere near that. Mostly these agencies are operating off of legacy agreements. I've seen agencies inherit them from other agencies. That seems to be the way they're perpetuated.
Other comments? It sounds like we've got, yeah, go ahead, Deb.
Just a scope question. So I was quickly rereading some of this, and so you just use an example of something you may be considering. So I guess there are 2 questions. Have agencies been informed that this process is beginning? And are we suspending existing? I know that you said many of the agreements have expired, but in practice, people are still using the agreements. Are we suspending those agreements while we do this review, or?
So prior to my taking on this file, agencies were informed that we were putting a hold on actioning further referrals. Over the last few months, it's become clear that some agencies would like us to explore allowing referrals on a case-by-case basis. And we're doing that. We're allowing agencies that feel like they can't wait to refer clients into the system who have existing referral agreements to reach out to us on a case-by-case basis to have that examined. But in general, we are holding those because our goal is by the end of Q1 to have a developed solution that we can bring forward for approval.
I don't mean to get into the weeds, but how do you determine on a case-by-case basis which agency you say yes to and which ones you don't? Paying attention to consistency and fairness.
So, our approach has been based on examining a combination of factors: staff and tenant records of complaints or other interactions with the agency. Agencies that score low on complaints are considered for a case-by-case solution. Agencies that score high on complaints are being held until we can develop a more more sophisticated rubric.
I assume there's also some tenant issue, like there might be an urgent. Is there any evaluation of the actual tenant that needs to be moved in?
No.
Okay.
Okay, I didn't think so.
Paula?
I just want to be clear that I'm sure there are RGI units. Are they all RGI?
Yes, so this policy
So that would be, that the service manager at the city would have to be involved in this review. That's
Yes,
my
so-
question.
Oh,
thanks.
So are they involved?
Yes, so
Okay.
the city must approve
Any
each of
changes?
these,
I'm asking if they're involved, not if you're
Yes.
sending them for
Yes.
approval. There's a
Yes.
difference. Thank you. That was my question.
Any other questions before we try to wrap up? All right, so I think that we will really like to see what transpires in this. I'm encouraged that we actually are digging up some things that we really should have been on top of for many years. And if you can keep us informed, that would be important, right? Yeah, and then if people actually on the board get any feedback from anyone, if you bring it forward, because I know that some of these things do have bring it to Scott. So good to meet you and see the work that's underway. So with that, I'm going to ask for a motion, that's what I was gonna say, to approve this, that you knew that, right? Yeah, well, it wasn't. To approve the supporting agencies referrals. Uba looks like she's ready. Seconder?
Second.
Scott, thanks. All in favor? Thank you. And then I need an approval for terminating the meeting. Motion to adjourn, John, seconded by Debbie. All in favor? Thank you very much, and thank you for everyone. We may see you at the board meeting, but if not, happy holidays to everyone.